alongside Dr. Ignatius Kibe, we've ably looked at, the causes that would get you to that point where you say, you're not able to sire. And the beauty of it all is that in all this, Daktari maintains that, the same can be reversed in most cases. Well, equally reminds you that, the aspect of infertility is not in totality. The fact that, lifestyle and how you handle things could probably get you to that point where you're infertile. But like we said, there can be a reverse of the same. And, in all this session or in all these classes that want to look at them, he mentioned a couple of things, a couple of issues that would get us to a point where we are infertile, especially for the girl child or for the women, and would want to trickle down in understanding, these systems or these conditions that would probably require surgery, and we have a reversal of the same, or if there's a way we can work around to make sure that you don't go through surgery, but at the same you have a reverse of the same, and you get to a point whereby you can sire. So we have this conversation on understanding some of these key things. We talk of cysts, we talk of fibroids. These are common nowadays, and every other time, left, right, and center, girls live with the fear of getting this. But we just get to understand, how do you develop fibroids? How do you develop cysts? And does it have to push you to a level where you have to undergo surgery? Karibu sana daktari.
Thank you very much, Linda.
Thank you. Good to have you.
To see you.
I'm happy to see you too. I'm really trying to, use these medical terms and get the best way to explain
to be a
this.
nurse.
At this rate, I think I am.
Yeah, you
and I'm getting more careful for myself, and I'm grateful for that.
Absolutely.
Out there, I'm also trying to, enlighten some young girls so that at least they're careful.
This is the best information that probably you'll give to not Kenyans, but to the world. And therefore, I'll start by correcting you. When you say something can be reversed,
okay,
it means it is not permanent.
All right.
So when you can reverse infertility, so the title should be subfertility.
Subfertility. I remember we keep saying subfertility. All right. So what is the difference between the two?
In infertility, could probably say the lady is barren.
Okay.
The man is barren.
All right.
Will never sire. But in and that is barrenness and infertility are almost synonymous.
And not so common. All right.
Subfertility is when probably hormones had gone haywire, and then we bring them back. So she was subfertile.
Okay.
She didn't get pregnant at the time she wanted. But eventually, after our interventions, she came by and got pregnant. Okay. So what you say is true, that there are certain conditions, some of them that can only be reversed through surgical interventions. Some of them can be probably handled medically. In medicine, there are 2 degrees. There is the medical, the MB, and then there is the BS, which is surgical. So what are we going to, shall we use medicine or shall we use surgical methods? Okay. And you mentioned a couple of them. One of them that is easily reversible and very common these days, like you said, are cysts, ovarian cysts, we call them. Ovarian cysts can actually cause subfertility, and many doctors dash to doing surgery, whereas I know that with careful medical management, it is possible to reverse subfertility due to cysts. A cyst is a small, like a blister, a small bag in the body containing fluid or semi-solid matter. That is what we call a cyst. And what happens is, these days, you rightly said it, Linda, that they are becoming more and more common. Why? Because ladies, and especially those who are doing various methods of family planning, they swallow or they get injections. They swallow a pill, they swallow a knee pill, or they swallow an ordinary pill, a microgynon or something, or they get a jab, they get probably a Depo-Provera. Now the big question that I want to ask Linda and nobody else, So when you don't become pregnant, do you ask yourself, where did that egg go?
Okay.
You had an egg, and you want
probably a couple of them.
And you now want that egg not to mature up, not to become a baby. So you swallowed a knee pill. So what happens to the immature or mature egg?
It goes and settles somewhere to become the cyst.
Finally, it becomes a cyst.
Okay.
Now, if you do it January, February, March, April, sometimes twice a month, you get polycysts. So we say the ovary is polycystic. Polycystic ovaries can be a big nuisance and can delay a lady's, or even permanently reject a lady's fertility completely. So cysts are small bags containing fluidish, liquid, or semi-solid material that sometimes are inside the ovaries or outside the ovaries. They could be on one side or they could be bilateral in both sides. Okay. And cysts can be a big nuisance because this egg that didn't jut out, that didn't jump out, that was not thrown out by the rupture of the ovary, continues to grow. And as it grows, it produces estrogens, hormones. And you know what happens with the hormones, these estrogen hormones, they interrupt the other hormones. I told you is like the gear of a car. If the body continues, the ovary in this matter, continues to produce estrogens, the other hormones, the luteinizing hormone and the follicle stimulating hormone and the progesterone, they get disrupted. If you get one gear of the car, like a reverse gear, sticking in and refusing to get out, then the car won't just move. So what happens with the cyst is that because of the excess estrogen, the effects are that she becomes subfertile. Number two, this girl, you notice that she can even grow a beard. Oh yeah? Girls with
from
polycystic.
Nowhere. Okay.
Yeah, from somewhere. She becomes androgenic. She becomes androgenic. The male hormone rises a little bit. And there is also an effect that it can give rise to or can itself be influenced by the flow of insulin in the body. And there is, this lady gets very severe pain, acute pain, during her menses. We call it dysmenorrhea. And she, like I said, and I'm repeating it, becomes subfertile. And we have to sometimes give polycystic ovarian disease medication. And along with that, give some those products like metformin. And quite often we can reverse sometimes, unfortunately, the cyst can become twisted or complicated. And if they do become complicated, we call for surgical intervention. So this is one of the reasons why you find doctors suggesting cystectomy. That's where we are now going to remove the cyst if there are many, the cysts, or if it is one. Sometimes we even do what we call laparoscopic. We go in with a very thin and narrow and painless needle, and we pop them up and do what? Suck the fluid. I said it is fluidish. So there are ways of dealing with the cysts, but cysts are not good.
They're not good. But then how do you know, or how do you work around things to make sure that, well, because then as it is in this time and age, they say family planning is crucial for some individuals who would, you know, be having reasons, tangible reasons to go for the same. So how do you pinpoint one that would be good enough, that would not risk or get you to the risk of
all family planning methods, Linda,
will get you to that level? There's no question about it.
No. Those that are hormonal family planning can resort to cysts. things like, or methods like a coil, a loop, a copper T. You know, some of these are physical. They don't go to the brain. They don't go to the ovary.
Okay.
So those physical family planning methods are safer in as far as cyst formation is concerned.
Okay.
Another common problem these days, because there are several, and we probably should go a little bit faster, are fibroids.
Yes.
And again, these are swellings. They are like some types of benign tumors. Benign here meaning they are not cancerous. And rarely would fibroids become cancer. But, and they are very common, a bit curiously, fibroids come in with the hormone. They are made more and they are made worse by presence of estrogens. The same hormone that makes you beautiful, the same hormone that gives you your breasts, femininity hormones, the same hormone that makes you the woman you are, estrogens, can precipitate or bring about fibroids.
Okay.
And we sometimes get confused. We don't know why exactly estrogens in a lady would precipitate, bring about fibroids. It's important to mention that fibroids are not a big story. Don't go scaring people and getting worried. Whereas they can, when they grow very big, they can prevent proper pregnancy. They are benign. They are not cancerous, number one. Number two, they are not, some people think they are diseases. Number three, they are very common. By the way, in Kenya, for every 10 women, 6
Aye, that's true.
have fibroids.
Okay.
So it's a problem. And unlike, you know, some people think fibroids are one type. No, there are several types. There are some that are within the endometrium, the inside lining. The lining, like I always demonstrate, the lining of the uterus can have fibroids, and we say they are submucosal. Some of them are outside, and we say they are subserosal. The worst fibroid is this one that we call pedunculated intracavitary. It is hanging inside into the ovary, the area where the baby is also born, where the baby develops. That one is a bad one.
Okay.
Fibroids can be small, tiny, like small peas or beans, and they can be big. They can be the size of probably an avocado or an orange. And they can be, there are several types. I wish to mention at this stage, you guys in radiology, you guys who do the ultrasound scans, tell us not just the size, but where the fibroid is. Because the intervention, and some of the interventions are surgical. Okay. You know, interventions will depend on which fibroid and where it is, and also the size of the fibroid. I want to mention that ladies, as they approach menopause, ladies who are, say, 45 and above, and up to 51, 52, may have fibroids, but what we do is we only observe and manage them. They can cause bleeding, PV bleeding, vaginal bleeding, but I want to say that as estrogens go down, the same hormone that we are talking about, as estrogens go down, the fibroids shrink or disappear altogether. So don't go invasively into an old lady, Dactaris, probably, unless, of course, she's bleeding profusely, like somebody mentioned to me this morning, or it is very severe pain or debilitating. Leave them.
They will disappear.
They will shrink or they become stationary with the age. Fibroids are, I'm repeating myself for clarity's sake, they are benign. They hardly become cancer. So that is another one. And occasionally...
Before you go to the other one, and before you respond, you say that there's one Dr. Karanja, may his soul rest in eternal peace, who constantly said that you can actually avoid this by getting babies early. Is it true?
Well, there is an observation. There is an observation that fibroids are more common. I also noticed that we did a survey. And do you know what we found? You see, Catholic nuns, because they don't deliver, many of them have fibroids. So we have an observation that a lady who after age 22, 23, 24, up to 30 gets 1, 2, 3 babies, hardly gets fibroids. You realize that our parents who had up to 9 to 12 children
would hardly
get fibroids. So they are more common with the people who do not get many or any baby at all. And now this is the issue of how do you deal with them, and it brings the issue of surgical intervention. Sometimes they are so disturbing that sometimes we can apply or we request an obs-gyn surgeon to exercise them, to remove them, to actually, they are like jiggers. So you just go around and remove them, more particularly if they're in the wrong places or big sizes. There are these days also methods of blocking blood flow to the fibroid. We select the arteries that feed the fibroid and we block it surgically, and sometimes we get the fibroid to probably become smaller and shrink, and finally to allow a pregnancy. So fibroids, I haven't seen very good medication for fibroids. What I have seen commonly is surgical interventions, not invasive. People should not fear. But and I've also seen for smaller sized fibroids, I've seen many girls become pregnant, women become pregnant, and they coexist with the fetus. So unless it is at a place, the fibroids are at a place like near the cervix or near the fallopian tubes, they can easily coexist. If it is pendiculated intracavitary or inside the endometrium and inside the uterine cavity, then it is a nuisance to the developing fetus. But if it is these fibroids that are subserous, that are outside, and those ones can coexist with the baby. And the mother becomes, delivers a healthy baby. But like I repeat myself, they can be and quite often are removed surgically. So
blocked fallopian tubes.
Blocked fallopian tubes. This is a very crucial area, and it is good to know that occasionally we try to do surgical interventions with blocked fallopian tubes. We call it tuboplasty, where we go and try to make, this is just like a pipe, a water pipe or a gas pipe, and it's blocked somewhere. And I want to stress that area, that portion. Why blocked fallopian tubes? They are not even like fibroids or cysts. Hiyo ni mambo ya kujipendea. Because the girl gets discharge, and this is, we have kept saying it is an infection. We've kept saying blocked fallopian tubes are due to sexually transmitted infections. And we have talked about gonorrhea. We have talked about chlamydia. In fact, chlamydia is the worst. Causes what we call inflammation. Imechomeka kule ndani. It's like a place where a flame has passed on. And these days, doctors, during my early days, we used to call them venereal diseases. Then venereal looked like love diseases. Then we reached a stage where we stopped calling them venereal diseases. We called them STIs, sexually transmitted infections. And some doctors would like to refer them because when there are many, pelvic inflammatory diseases, PIDs. And I want to warn men here at this juncture that when your wife tells you that I have discharge, and my discharge is probably fall odored or it is smelling bad, you men agree to go to hospital, Bwana, or take the medication.
Go alongside them.
Go alongside your wife, or if you are shy, let her come with your dose. So,
and in the process, do you actively engage? Do you engage in intercourse?
When we are doing treatment, the best thing is to abstain.
Okay, hold it. Hold it at that. Let's take a quick break and then we come back. Best thing is to abstain, but for how long? All right. After this break.
In a crowded, confused, and uncertain career market after KCSE? Worry no more. TV47, the fastest growing youth-targeted TV station across the 47 counties, brings you an entire month of career options and choice opportunities across all the leading universities and TVET institutions. We have put together a rich group of experts who will guide you through your career aspirations throughout the month of May. This will climax with a virtual career fair scheduled for the 28th of May at the University of Nairobi Auditorium. All relevant stakeholders are invited to reserve a seat via david.katiku@tv47.co.ke or careersfair@tv47.co.ke on 0791 999 883.
New Blue Band peanut butter. Made with 100% pure peanuts. And a good source of omega-6. Grow healthy and happy kids with New Blue Band peanut butter.
Hey, now that's hitting the right notes. When life gets boring, we bring out our play. You see, playfulness is in our DNA. It's in the way we move and laugh. It's in the way we walk, the way we rock, and how we just don't stop. You feel me? We add color to everything, to every day and every dish, because the world needs our crazy. We're the different flavors that make life more exciting. We're the ones who add color to every moment. Fanta, color every moment.
Raukia siku njema na tunukiwa offers kila siku. Pata offers zote mahali pamoja ili uongeze zaidi, utume SMS zaidi na ubrowse zaidi.
Wewe usijali. Tuma namba ya kila supplier kwa hiyo soko. Ndio nitaongea na kila mmoja wao.
Very good. Piga *444 utunukiwe Credo double.
Raukia siku njema na tunukiwa offers kila siku.
Oh, hi. It's not what you're thinking. It's a cup of coffee. Coffee, movie. Together, coffee and movie. Every Sunday, 8 p.m. on TV 47, where we bring you interesting, enticing people. Well, we've concentrated on musicians.
Yeah.
What you are
Yeah.
About now, we want to go beyond to. So, let the sun stand still like Joshua time for 3 hours, but this time for only 1 hour. We bring you coffee with movie, interesting, enticing guests. Au sio? Tunaweza anza tuna Mombasa, Kisumu, Nakuru, twende Mbiland, TZ, you never know. It is coffee with movie. Jua unaweza enda sasa.
Okay. Yes.
Numbers maintain the standards.
Aitoi ile garlic inafaa itoi, that standard garlic.
Reduce the cost.
We spread our risk.
And yet remain the best. Kilimo Diary. The story continues to unfold. The race to win Abel's heart continues.
Mwanamke ataniona, Abel is my mwanamke mgani, ni nani huyo na nini mbaya?
The betrayal.
Manze chinja huwa hakuna blanda sasa ndio huyo yule madam pale hivi sasa.
And the secrets.
Jenny, si nikwambia napenda Abel. Nampenda tena sana. Nashindwa venye nitaanza. Lakini nashindwa nitaanza aje.
Usichekeshe.
Plan ya siri every Saturday at 8 p.m. Did you know?
Always tell yourselves, one day at a time. You can't do everything.
Over time, I've had to realize that good things take time.
The Grind, every Monday at 7:30 p.m. As the country BI referendum.
To familiar this 5 years term as the deputy president.
Pundits